Thank you, Felipe. Welcome to Medtronic Operational Headquarters in Minneapolis, Minnesota. My name is Dave Berggren from Medtronic Corporate Communications, and with me for a very special conversation is Dr. Austin Chiang. Dr. Chiang is one of the few triple board certified advanced endoscopy trained gastroenterologists in the world. He is the founding president of the Association for Healthcare Social Media and a prominent social media influencer among the gastroenterology community. Dr. Chiang pioneers the use of social media for education and outreach for gastrointestinal related conditions and medicine in general. Since October 2021, he joined Medtronic as Chief Medical Officer for the gastrointestinal business. So we are thrilled to have Dr. Chiang in person. Many of you have seen him on social media. He's kind of a big deal, right? Can I say that?
I don't know about that, but
well, we'll get to that, okay? We'll get to how big of a deal you are. But I've got a few questions for you, so thanks again for being here as part of this forum. Yeah, it's great to have you. First of all, how's your first year at Medtronic been? Pretty good?
It's been great, yeah. I've had a great time so far. Really excited to be here. Super excited about all the technologies that are coming out. Yeah, it's a great company.
Yeah, that's fantastic. So on that note, you mentioned technology. How has patient experiences in the gastroenterology field changed thanks to healthcare technology?
I mean, I feel like it's had tremendous impact on patient experience because, you know, gastroenterology is a very procedural field. Everything that we do is either through the mouth or from behind through a scope. That's what gastroenterology is really all about. And technology has really allowed a lot of these procedures to become less invasive. Things that used to require surgery, where patients had to be opened up, now can be done through a scope. And so it's been a tremendous impact for patients. Additionally, if we think about Medtronic gastroenterology, this business hasn't been in existence for very long. So if you look at what we have in our portfolio these days, we're impacting so many patients in so many different ways, and just in a very short amount of time. So I'm very excited about how we're able to improve the patient experience.
And that's what it's all about, is patient outcomes. Obviously, and the future is bright. You're excited about the future. What are some of the technologies in the gastrointestinal business that excite you the most, and how bright is the future?
Very, very bright. I think within the past year, the biggest splash that we had in our field is really being first to market with artificial intelligence. It's the first artificial intelligence sort of powered polyp detection tool, which helps doctors be able to better identify precancerous polyps before they develop into colon cancer during colonoscopy. And you know, that's only one of the technologies that we have in our portfolio that's really exciting. Gastroenterology really is a field that's not only involving the gut, but also different organs like the liver, the pancreas. And we have technologies that really span all different aspects of the gastrointestinal tract and also across the whole patient experience, from prevention to detection to treatment. So we're covering it all, and it's super exciting.
That is super exciting. And Doctor, you're also using, a lot with your practice, you're leveraging social media as it relates to awareness and educating patients. How did that all get started? How did you become such a big deal on social media?
I mean, I've always loved social media, and you know, I noticed its impact on patients very early on. Patients were coming into the hospital based on things that they were hearing through media, through social media, and sometimes making incorrect decisions because of that. And so I wanted to make sure that me and other health professionals were more present on social media to be able to educate and provide accurate information. So that's how I really got into it, and I ended up going from platform to platform, Twitter, Instagram, YouTube, TikTok, and adapting to each of the different cultures on those platforms to educate in an entertaining and fun way, and packaging that information, that message, so that patients could, you know, learn in a different way depending on whoever the audience is on those platforms. And since then, I've been able to kind of grow to a following of over 500,000 on TikTok, for instance, reach a much younger audience, but also speak to my professional colleagues on Twitter, you know, on the other hand, and be able to message differently and communicate in different ways. So it's been very exciting. I've had a lot of great opportunities as a result. You know, earlier this year, I went to the White House as part of the Healthcare Leaders in Social Media Roundtable. Also represented Medtronic in a colorectal cancer awareness effort that we're continuing to work on with the Cancer Moonshot program. So very excited about all of that as well.
And you're seeing an impact as well, and it's making a difference. You being on social media is making a difference for patients. Am I right?
Yeah, it's one of the most gratifying things about being on social media is that I get that direct feedback from patients where they tell me that because of a video that they saw or a post that I made, that they actually got screened for colon cancer, that they told their family members about it. So I'm seeing that real-time feedback, and it's what keeps me going, really.
As it relates to the digital age that we're in, the digital age of information, you're also very passionate about fighting misinformation. What are some of the most common misconceptions around colon cancer, and how do you approach kind of battling misconceptions on the internet?
Yeah, I think, colon cancer is one of those conditions that's really stigmatized. I think a lot of people are resistant to getting, their colonoscopy done, which is the gold standard for colorectal cancer prevention. A lot of people think that it doesn't apply to them. And really, the recommendation now is that for most people out there, everyone has to start screening at age 45 here in the US. And then, the screening guidelines do kind of vary across the world. But generally speaking, there are guidelines out there. And it can be very easy and simple and painless. It doesn't require, it does for colonoscopy, you just go to sleep, you get the procedure done, and you wake up and it's like a day at the spa. And we are able with our technologies to be able to detect things early and even remove some things before they become cancerous, which isn't the case for all cancers. So it's really one of the most preventable cancers out there.
And then maybe final question as we wrap up here with you, Dr. Chiang. How exciting, just in general, as you step back and look at kind of the landscape of that intersection of healthcare and technology, how exciting is this field?
It's amazing. I mean, I think that we're at a point in time where technology is really starting to impact how we practice healthcare. As a physician, I look around what I do, and it's really everywhere. Without technology, without innovation, it's really medicine would be very, very different. And so I'm very excited that we at Medtronic here are at the forefront of providing that innovation and driving that forward. So very excited about everything that we're doing.
Dr. Chiang, this has been a great conversation. Thanks for being here.
Yeah, thanks for having me.
We so appreciate having you. And follow him on all the social media platforms. He's a big deal. So thank you again, Dr. Chiang. And thank you for watching and participating in this year's conference. And we will see you later on in the program.